Hello, my name is Dr. Maria Shapoval. I'm a naturopathic doctor and I focus on neurological conditions. I'd like to tell you a little bit about my practice and the types of conditions that I treat, as well as some of the treatment options that I offer. So in terms of conditions, as I mentioned, I focus on neurological conditions like Parkinson's disease, Alzheimer's, multiple sclerosis, epilepsy, seizures, concussions, and other types of movement disorders. In terms of the treatments that are available, so one of the basics that I offer, that I focus on, is lifestyle and diet and exercise. And I frequently get asked the question of what is the magical supplement, what is the magical pill, and I can honestly say that it's the diet and lifestyle that are the main go-tos for me in terms of what I offer in my practice. That's not to say that there aren't things that can be offered in terms of supplements or botanical medicine, but the basis and foundation of what it is that I offer to patients is largely lifestyle, diet, and exercise, which I can talk to you more about in a different video in terms of what are some of the things that you could be focusing on if you wanted to optimize your brain health. In terms of other treatments that are available, I'm trained in scalp acupuncture as well as regular acupuncture, which could be combined with electrical stimulation. And the interesting part about scalp acupuncture is that unlike other forms where you get to relax, you're lying on the table, you have the needles in various parts of the body, scalp acupuncture is actually very active, where once the needles are in place and they are placed around the scalp, on the scalp, you're actually engaged in a lot of different physical activities, whether that's stretching or you're doing improving your gait, or walking faster. We're working on improving your posture. So it is a very different experience of acupuncture. Some of the other treatments, as I mentioned, are botanical medicine as well as supplements. And if you're wondering, I'm sure you are, in terms of the research behind what we do, there is quite a lot of research out there for the use of botanical medicine as well as various nutraceuticals. Unlike the popular belief, there are actually quite a number of clinical trials that support the use of these therapies. That being said, there is of course room for growth. And one of the things that I really spend a lot of time with my patients on is talking about what type of research is available so that they can make the right decision for them, so that it is truly an informed decision where you know that this is based on clinical trial, or no, this is based on theoretical use, and we have traditional use of these herbs for hundreds of years, but we don't always have the kind of research to say that here are the outcomes that you can expect. And I think that especially in the field of neurological conditions, where some of these conditions we don't have the best care available, whether it's in any form, there may not be a cure, but obviously patients want to have options and to see if there is something that could maybe not stop the progression of the disease, but at least improve their quality of life. And I think that's where it's important to make an informed decision to see what type of research is available and what are the risks of that therapy. Maybe the potential benefits are worth the risk, or maybe they really aren't, and we don't know enough about this type of therapy to really be experimenting with it. So as you can tell, I spend a lot of time talking about research, and that's because I do spend a fair bit of my time exploring the latest research in these conditions, as well as looking at the latest updates on treatments. My background is in physiology and psychology from U of T, and after the 4 years of naturopathic school, I did a 2-year residency which was focused on the research in naturopathic medicine. And so I continue to write articles, present at conferences, and take on extra courses, because I think it's very important, obviously, to offer you the latest research that is available. And in this day and age, we have so much information that is coming through. So I think it's, again, very important to know the quality of the research behind some of the options that are available on the market, and to see whether it's a myth, it's a fad diet, or if it's actually something that's safe and possibly effective. Also to add, in addition to kind of like here are the therapies that are available, I do network with other healthcare providers so that I can let you know if there are different treatment options available that I may not be qualified to provide. And one of those therapies is intravenous therapy. That's not something that I'm pursuing, that I'm trained or certified in, but I know of a number of colleagues who are, and that may be something that at some point is worth having a conversation around to see when and where that's the right course of treatment, in which case I'm more than happy to work with the colleagues that I have and make the appropriate referral and recommendation. So if you're interested in more, I will be posting other additional videos talking about the specifics of treatments for Parkinson's or Alzheimer's or migraines and the other various neurological conditions that I treat. If you have any questions, please feel free to drop me a line, and I look forward to working with you